Welcome to our third section of our Chapter 11 lecture, where we're going to discuss some muscles of the body. Our first group are the muscles of facial expression, and the first muscle you'll see here is the frontalis muscle. This causes a wrinkling of the skin on the forehead, so when you raise your eyebrows, those usually transverse wrinkles that get formed on your forehead is due to this frontalis muscle. Next, we have orbicularis oculi, and this is going to help to close our eyelid, and you could see it in the orange over here. And we have two different parts of this orbicularis oculi muscle. We have a portion on the outside, which is the orbital part of it, that is going to help us just close the eye, like when we blink. Or if we want to squeeze our eyes shut, then we can utilize the palpebral part in order to more tightly seal the eye. And then we have our orbicularis oris. This is the muscle in purple over here, and this is going to close and purse the lips. So if somebody was doing the kissy face or just even movements such as closing our lips, that would be our orbicularis oris at work, or you use it while you whistle. And then we have our Risorius muscle. This is going to pull the corners of our lips laterally, kind of like a grimace look. And we also have these two muscles that are found superior to that, which is our zygomaticus major in blue and our zygomaticus minor in green. And both of these are pulling the corners of the lips up in order to smile. I always try and compare these two muscles because they're going to give a little bit different look. So here is Jessica Alba with the zygomaticus major and minor muscles at work. You can see that the sides or the corners of her mouth are curved up, whereas if you have more of a strong Risorius muscle, then you're going to have more of a straight on type of smile like Lauren Conrad here. And then we have our buccinator muscle. Now this muscle is a little difficult to see in this view because Risorius is covering it, but this teal muscle here, which is more of a rectangle type of shape to it, is going to help tone in your cheek, will be used during sucking and whistling. So this is the muscle in totality here with the Risorius moved out of the way. Like we said, it'll compress the cheek, and then even when you whistle or play any windpipe instruments, you'll be using this buccinator muscle. It'll also help to hold the food between the teeth during chewing and draw the corner of the mouth laterally, and it is well developed in infants who are nursing because of that sucking motion they have to do in order to get breast milk. Next, we have the levator palpebrae, and this isn't one that you really see well externally, but we see that if we take a view of the bony orbit here and some of the eye muscles, this superior strap-like muscle is coming over the eye and attaching to our eyelid over here. So this is going to contract and open up the eye or pull up the eyelid. Then we have your platysma, and your platysma is this muscle over here. It's quite large. It's interesting because it is a subcutaneous muscle. So what it's going to do is be able to depress our mandible and also the corners of our lips down. And you can also add that it kind of pulls up our skin. So here you can see that skin being pulled up. Now let's move into some other muscles of the body. Our next group, which is muscles of mastication. First, we have our masseter muscle in blue here. This is going to strongly elevate the mandible and close the jaw. So I forgot to mention that mastication means chewing. So by elevating the mandible, we are able to do that chew motion. And then we have your temporalis muscle in green. And we also see it with the masseter dissected away here and its relationship with the mandible attaching to the coronoid process there. And this temporalis muscle will also strongly elevate the mandible and close the jaw. Sometimes as people chew, you might even see this muscle pulsating on the side of their skull. Now for some muscles that are going to move the head and the spine. We have the sternocleidomastoid muscle here in green. Sterno meaning sternum, cleido referring to the clavicle, and mastoid because it attaches to the mastoid process here. And when these muscles on both sides, which we would use the term bilaterally, contract together, they are going to flex forward. So we would flex the neck really. And if they're working singly, or what we would say is unilateral, meaning just one side, we would be able to tilt and rotate our head to the side. Now, if you look at this view down here, you could see these strap-like muscles over here. Now, we do have these different groups. Here's our hyoid bone. So one group of muscles above the hyoid bone is called the suprahyoid muscles, and the muscles found below the hyoid bone are called the infrahyoid muscles. The only one I'm holding you responsible for is knowing this sternohyoid muscle. This is going to depress the larynx and the hyoid bone. Continuing on, we have this muscle here overlaying the occipital bone, which is occipitalis. This is going to move our scalp posteriorly. Our next muscle is splenius capitis. So here is our skull, and capitis, if you recall, means head. So this is a bandage-like muscle that attaches to the head, and this is going to assist us in turning our head side to side in order to say no. You could see that down here we do have a cervicis version of it. That just means that this portion of the muscle is attaching to the cervical spine here. Now if we look at the larger bulk of muscle on your back, we have this muscle here called erector spinae, and this is going to extend the vertebral column. It really serves as a postural muscle to hold us upright. And we can break this down into 3 separate muscles. Please add this into your notes. So first one, we're going to start laterally, is your iliocostalis. Ilio because it attaches to the ilium here, costalis because it's attaching to the ribs. Longissimus is in red, and this is the longest of all 3 muscles. You can see it's going to go and attach to the skull here. And then we have the spinalis in purple, and this is the most intimate with the spine. And this muscle here, by the way, is that splenius muscle we just learned about. And a good way to memorize the order of these muscles is the phrase, I love spaghetti. I is for iliocostalis, which would be lateral. Next we have love for longissimus, and spaghetti is spinalis, which is most medial. Now let's talk about some extrinsic muscles of the eye. These are going to be muscles that help to move the eyeball around. So we're not changing the pupil size or anything like that. That would be an intrinsic eye muscle movement in order to do that. So first, let's take a look at the superior rectus muscle. You could see it pictured here, as well as this muscle over here. This is going to help to move the eyeball upward if it were to contract. Next, we have our medial rectus muscle, which we can't see in this view because it's actually on the other side, but we can look at it over here. And really, it looks the same as the lateral rectus, just on the opposite side. Medial rectus is going to assist with moving the eyeball medially or in toward your nose. Next, we have your inferior rectus muscle. We see it pictured down here, and it is this muscle over here. Inferior rectus is going to move the eyeball down. Our lateral rectus, which we referred to, is over here. And we see it over here. This is going to move our eyeball laterally or outward. Next, we have 2 oblique muscles. So oblique, remember, means diagonal. So these muscles are interesting in that they're going to move diagonally across to the eyeball. So our superior oblique over here and over here is very interesting because it goes through a little pulley system over here. This is actually called a trochlea, and then that tendon is going to whip around and attach to the eye. This causes the eyeball to move downward and outward, or rotate outwardly, or we can almost describe it as a external rotation of the eyeball. Next, we have your inferior oblique muscle, and you could see that it is coming in diagonally down here, and we can also see the inferior oblique muscle here. This muscle will assist to move the eyeball upward and outward rotation, or again, that external rotation of the eye. Now we're going to discuss some muscles of the abdominal wall. First, we have your rectus abdominis muscle. This is separated by bellies of tendinous intersections, and this is going to vary genetically. Some people might have more of these tendinous intersections than others, but this is essentially the muscle that gives you that six-pack look. And then the other muscles we'll discuss are found laterally. So these next three muscles are layered on top of one another. We've got your external oblique muscle, internal oblique, and your transversus abdominis. And notice that these muscles have a flattened tendon that are going to layer amongst one another, causing an aponeurosis, a flattened tendon. Then as they move medially, the external oblique will sit superficial to the rectus abdominis muscle, and this internal oblique tendon will split. So you could see that half of it covers it superficially and the other half covers it deep. And then lastly, we have the transversus abdominis, and that travels deep. And altogether, that's going to form something known as the rectus sheath. So here is that external oblique muscle. You could see anteriorly it forms that aponeurosis, but notice the fibers are moving downward, medially and downward. And this muscle, along with the internal abdominal oblique muscle, when they work on both sides, so bilaterally, we are going to see that they will flex the vertebral column. So essentially you're bending down at the trunk. And then if it contracts on its own on one side or unilaterally, that means we are going to laterally flex. It'll also help to compress abdominal content. Now, when we cut that external oblique out of the way, we could see the internal oblique muscle over here. And like I mentioned, we will have the same actions as the external abdominal oblique. So bilaterally, this muscle will flex the vertebral column, and unilaterally, it is going to cause lateral flexion, and it too will compress the abdominal contents. And then we have our rectus abdominis pictured here again for you to see the full length. Now, when we cut the internal oblique out of the way, we are going to find our transversus abdominis muscle. Notice how these muscle fibers are going in the transverse direction, and its job is just really to compress the abdominal contents. We always say this is kind of like the girdle of the, or the corset, not girdle, but the corset of the abdomen to kind of hold everything in. And this is the deepest layer of muscle on our lateral abdominal wall. Here's what it looks like on a cadaver. You could see those nice transverse fibers in there and the other obliques peeled away. And let's do a little review here. We've got this in green as the rectus abdominis, good. This here, most external, is the, hint, hint, external oblique. In purple here, we have the internal oblique, and notice how it's cut out. So we are going deeper, and now with our next cut out in orange here, we have the transversus abdominis is correct. And here is a view of the rectus sheath once again. Remember, this is a fibrous structure that's formed by the aponeurosis, which is the flattened tendon of external oblique, internal oblique, and transversus abdominis. And here is another view. Once again, this is a cross-section of our abdominal muscles. You could see that external oblique forming the superficial layer of the rectus sheath, the internal oblique splitting in half, forming superficial and deep layers. And lastly, we have the transversus abdominis forming the deep. And there's that view again. And just another figure to find these muscles. And here is another view where you could compare the fiber direction, where the external oblique is moving medially and inferiorly. With your internal oblique, you'll find that some of the fibers are moving superiorly and medially, and then some of the fibers will move inferiorly and medially, depending on where you're looking. But the transversus abdominis will only go in the transverse direction. And now for some muscles for breathing. We have our external intercostal muscles, inter meaning between, costal meaning rib. So we are going to have these muscles helping us raise and spread the ribs in inspiration, or when you are inhaling. And then we have your internal intercostal muscles, which are going to assist us in forced expiration only. So when you are breathing out, and really pushing your rib cage down to push all of that air out of your lungs as much as you can. At least we have a little bit of air left in there so our lung does not collapse. And then we have the diaphragm. Our diaphragm helps serve as a partition between our thoracic and abdominal cavities, and it is the most important muscle in inspiration. The way this muscle works is we need our phrenic nerves to innervate it, so that it'll push abdominal contents down. And if you look at our diaphragm here, you can see that when the phrenic nerve innervates it, which by the way comes from cervical nerves C3, 4, and 5, and when we contract that muscle during inspiration, which you see pictured over here, you will see that the diaphragm will flatten. When that muscle relaxes and does not receive stimulation from the phrenic nerve, it is going to be in this dome shape during expiration, or when we are breathing out. And that makes sense, right? Look here, the lungs are inflated and we are pulling it down to make more room for our lungs to inflate. Whereas here, the dome shape is almost like pushing up on the lungs in order for us to push that air out of our body. And the way we can remember where the phrenic nerve comes from is by this fun jump rope saying, I guess you can use, is C3, 4, and 5, keep the diaphragm alive. C3, 4, and 5, keep the diaphragm alive. I know you'll all be running outside in the spring to do this with your friends and sing this saying.